Hello, everyone. Welcome to LUMP, TCM, and Acupuncture series for beginners. And we would like to start this afternoon with our first presentation. Let's welcome Sir Dino Pinheiro, Certified Associate Acupuncturist of Legazpi City. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with the 5 elements interrelationships. So we have here a diagram, the 5 element interrelationship, the different elements and its K and Shen cycle. So another 5 elements, the Shen, which is the generating, the K, which is the controlling, acting. If there is an imbalance, not generating, or it could be over-controlling, overacting, or insulting, rebelling. So finding the patterns, first we find which 2 organs that is related to, and second, find in which cycles Shen or Kes cycle they belong to. Number 3 is to determine the imbalance. So first example, signs and symptoms like cough, the area of the lung, restlessness sa lungs, loss of voice, there is sa lungs din. Asthma, which affects, it could be lung or kidney. Sa pattern, metal not generating water. Second example, there is a palpitation affecting the heart, insomnia, heart, and sa breathlessness sa lungs. Sa pattern, we have the metal insulting the fire. The opposite, fire overacting on metal, would have more metal signs and symptoms, cough with profuse yellow sputum, feeling of heat, merong red face, color manifesting in face can help indicate an overacting sequence. Thank you for your attention.
Thank you very much, Sir Dino. Okay. We will now start with a new topic, the wood element. So the liver stores and releases blood. It also secretes bile, and the liver generates wind and ensures free flow of blood, energy, and body fluid. Liver controls muscle strength and tension, nourishes and controls tendons. The liver opens to the eye. The sense is sight, secretes tears, nourishes the nails. Associated emotion is anger. The flavor is sour. Energy-giving color is green. Associated season, spring. Climate, wind. The coupled yang organ is gallbladder. So here you could see the different tower diagrams in which you have 3 examples for the yin dominant states and 3 examples for the yang dominant states. And the yin and yang dominant states are balanced. The liver yin stores blood in the vessels and the body. The liver yang releases the blood to the rest of the body when it needs blood for energy, and also releases the blood out of the body in times of bleeding. When liver yin is deficient, it has less capacity to store the blood within the vessels, and therefore, when there is an injury, the patient tends to carry on bleeding as blood coagulation is delayed. You will have no problem recognizing such patients because when you remove their needles at the end of treatment, at least half of the points will be bleeding, and they will continue to ooze blood for a few minutes. It is as if the patient was on anticoagulants. The liver yang releases the blood outwards. In the case of yang excess, there can be spontaneous bleeding. A combination of liver insufficiency and yang excess is perhaps the worst combination possible, as in the case of liver cirrhosis, as here the patient tends to bleed spontaneously and excessively. When there are signs of blood deficiency, like paleness, tiredness, dizziness, feeling of numbness in the hands and legs, and long menstrual cycles with scanty bleeding in women, this is called liver blood deficiency. It is not necessary that the patient's hemoglobin count should be low to substantiate such a diagnosis. The symptoms are sufficient. In some patients, this could be a temporary state following an accident with much loss of blood or a serious illness or childbirth. The symptoms could improve after a short period of blood building. We can assist blood building by tonifying heart yin and yang, as it is heart that nourishes and synthesizes blood. Excessive and spontaneous bleeding can occur from any organ, but the underlying cause of this bleeding lies in the dysfunction of the liver. When liver has fire heat, that's yin deficiency and yang excess, that makes it release too much blood and store too little. But then, why does the bleeding occur in different organs in different cases? This is because the organ where the bleeding occurs is also in a fire heat condition. So let us now explain what is meant by the term fire heat and why bleeding occurs in these cases. In the case of a balanced organ, if the yang increases in this organ, the organ will react by increasing the yin as well. So this situation is called damp heat, with heat and fluid. This is how the body tries to balance the situation. It reacts with fluid in order to control the yang. This is possible as there is a good amount of fluid in the body. But when there is less fluid, where there is dryness and inflammation or fever, there is not sufficient yin to react with. The only way to balance the situation is by elimination of the heat. And the quickest and most effective way to eliminate heat is to bleed, hence the bleeding. This is not slow bleeding or spotting. It is arterial bleeding, red and fluid, and excessive. Thank you very much for your attention. Let's now welcome once again Sir Dino Pinheiro, who will discuss the next topic on urination. Good afternoon once again, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with the topic, urination. An interesting interaction between the doctor and the patient. So, sabi ng doctor, how is your urination? The patient replies, normal, or it could be like this. Sabi ng doctor, do you go sometimes have burning urination? Ang reply ng patient is yes. We can do nothing with this information. Who is the judge about what is normal? Do we not sometimes have burning sensation, burning urination? It could be because we did not drink much that day. It would have been better to ask the patient, how many times in a day do you pass urine? How many times in the night? What is the usual quantity you pass? What is the usual color? Do you have any problems with your urination? If the urination is frequent, it is important to know if the frequency is related to nervousness. In the case of yang, or more often at night, yin, or all the time. If the urination is infrequent, when the color should tell us if it is concentrated or turbid. And we should check to see if the patient is generally very dry or if he or she has edema or sign of water retention. So we have here the first tower diagram. Deficient ang yin, normal ang yang. So kidney yin deficiency, urination 2 to 3 times per day, little and concentrated dry person. Next tower diagram, deficient ang yin, excess ang yang, urinary bladder heat. There is a scanty frequent 2 to 3 times per hour, urgent and painful urination. Next tower diagram, both yin and yang are deficient. There is kidney urinary cold. Often and little, worse at night and cold weather. Next tower diagram, normal ang yin, deficient ang yang. So there is a kidney yang deficiency, increased night urination. And yung next tower diagram, both yin and yang are deficient. So kidney yin and yang deficiency, leakage of water. There is an excessive thirst and excessive frequent urination, dry person. If these symptoms are present with heat, restlessness, and a red tongue, it could be heat in the upper warmer because the water in the kidneys cannot control the fire. Sa treatment, kidney yin deficiency, we use kidney 10, water point or house element point, or kidney 7, tonification, the mother point. REN 3, UB40, spleen 6, if urination is concentrated or burning, which is the root point urinary bladder, grandmother point urinary bladder. Drink more water and eat salty food. Pag merong heat in the urinary bladder, we use REN 3, which is the root point urinary bladder, cools and calms point. Spleen 6, the distal point of lower warmer, UB40 controls urinary bladder, yang on the controlling cycle. Bleeding cap on UB28 shoe point urinary bladder to release heat, rest, drink more water, keep warm. Kidney yang deficiency, UB23, shoe point of the kidney 3 grandmother point, increase yang in yin organ, UB67, tonification point, UB tonifies kidney yang indirectly. LI11, stomach 36, tonify yang organs in mother and grandmother elements. Next, kidney yin and yang deficiency, we use GB25, UB23, the mu and shoe points. Kidney 7 and UB67, tonification point. Spleen 6, distal point. Lung 9 and LI11 to tonify the mother if necessary. Urinary bladder yin and yang deficiency. We use REN 3 and UB28 mu and shoe points. Kidney 7 and UB67 tonification points. Spleen 6, lung 9, and LI11. Thank you for your attention.
Thank you very much, Sir Dino. Next, we have metal element. Lung controls respiration. The lung is a respiratory organ and breathing is its function. Ease of breathing and having enough air to function are indications of healthy lung function. So here we have a tower diagram indicating lung yang excess. Okay. Lung yang excess could manifest as acute bronchitis with cough, pain in the throat and chest when coughing, yellow or green mucus, fever, and excessive sweating. It could also manifest as an acute asthmatic attack with bronchial spasms. In both cases, breathing would be difficult and the patient will be better sitting upright as they are unable to breathe in a lying position. So below, you could see the tower diagram for lung yang deficiency and another tower diagram for lung qi deficiency. Yang deficiency is coldness, and this is a chronic state. The lung would be vulnerable to cold at yin times of the day, and symptoms of cough and asthmatic breathing will occur regularly, especially in cold weather and at night. Lung qi deficiency is poor function, again in a chronic situation. The patient suffers from shallow breathing and sleep apnea because qi deficiency worsens in the passive state. If there was mucus, the patient would not be able to cough strongly enough to expectorate it because of the qi deficiency. Lung yin deficiency means that there is dryness with little or no mucus. If there is mucus, it tends to be very thick, like glue. There is no problem with breathing, but the cough is dry. And for the exchange of air to take place in the lung to the blood, there should be some moisture present. If the dryness is serious, then the patient would be short of air when active. This is typical in smokers. Next, we have lung yin excess and lung qi deficiency with dump stagnation. Lung yin excess. The best example for this acute condition is lung edema, but it could occur in a qi deficient state as dump stagnation when the spleen generates excess dump or when lung qi cannot circulate or eliminate it. This would be common in illnesses such as asthmatic bronchitis or emphysema. Hyperactive or hypersensitive yang in the lung is either a subacute or a recurrent state with severe dry cough, perhaps tasting a little blood with the mucus, worse at nights, with night sweating and feverishness, or it could be recurrent asthma on exposure to an allergen or with extreme anger. The acute asthma attack is accompanied by dry bronchial spasms, very sudden and severe. Bronchi become hypersensitive because the difference between the yin and yang is the maximum in this relationship, rather than any other yang dominant state. The bronchi are abnormally sensitive and can go into spasms or hyperactivity. To reduce their vulnerability, it is necessary to dull their sensitivity or reduce the distance between the yin and yang. Thank you very much for your attention. Let's listen once again to Sir Dino Pinheiro for the next topic, still on 8 principal syndromes. Good afternoon ulit, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with the 8 principal syndromes. Yin and Yang. Yin and Yang is a pair of principles used to summarize the other 3 pairs of principles and are also the key principles in 8 principles. So other 3 pairs of principles are classified under either yin or yang. Exterior, heat, and excess syndromes are classified into the category of yang. Interior, cold, and deficiency syndromes fall into the category of yin. First, the yin syndrome is characterized by deficiency of yang, qi, and excess of yin in the blood. Different symptoms are shown in different yin syndromes. Sa manifestation, the yin syndrome is generalization of interior, cold, and deficiency syndrome. First, there is listlessness, lassitude, and low voice are the manifestation of deficiency syndrome. Number 2, cold form, chills in the limbs, absence of thirst, foul stools, and increased amount of clear urine are signs of exterior cold. Number 3, pale and enlarged tongue, deep and slow pulse, weak, tardy, and choppy pulse indicate deficiency cold. Next, we have the yang syndrome is characterized by the hyperactivity of yang qi and hyperfunctions of sangfu organs, resulting from excessive yang heat in the body. Different symptoms are shown in different yang syndromes. Sa manifestation, the yang syndrome is a generalization of exterior heat and excess syndromes. First, there is aversion to cold and fever seen at the same time are characteristics of the exterior syndrome. Number 2, flushed face, restlessness, dry mouth, desire for drink, short micturition with dark color urine are the manifestation of the syndrome. Number 3, loud voice, rough breathing, dry stools are the symptoms of excess syndrome. Number 4, dark red tongue with yellow dry coat. The pulse may be superficial, rapid, or full and big, or rolling pulse indicate excess heat. Sa differentiation between yin and yang syndrome. Sa yin syndrome, sa inspection, it is pale or dim complexion, heaviness of the body, lying in a curled up posture, lassitude, listlessness, pale, delicate tongue, moist and slippery coating. Sa yang syndrome, there is smaller flush face, feverish, preference for cold, irritability, restlessness, dry and cracked lips, crimson tongue, yellow or stained yellow coating, even dry, cracked, or dark and turny tongue. Sa auscultation and olfaction, sa yin syndrome, there is a low voice, quietness, disinclination to talk, quick breathing, short breath. While sa yang syndrome, sonorous voice, irritability, polylogia, hoarse and asthmatic breathing, rattle in the throat, shouting, and yelling. Sa interrogation, foul stools, yin, foul stools, loss of appetite, tastelessness in the mouth, absence of irritability and thirst, or preference for hot drinks, an increased amount of clear urine or scanty urine. While sa yang syndrome, there is dry or hard stools or constipation, stools with foul smell, no desire to eat, dry mouth, irritability, preference for drinking, yellow and scanty urine. Sa palpation, there is abdominal pain, alleviated by pressure, chills, cold feet, and deep, faint, ready, and smooth and forceless pulse. Sa yin syndrome yun. While sa yang syndrome, there is abdominal pain, aggravated by pressure, warm body and feet, superficial rapid, smooth, and forceful pulse. Number 3, the collapse of yin and yang. In a critical stage of disease, yin and yang may be exhausted simultaneously. Yin humor is dried up and yang is collapsed. Both of them can no longer support each other. Such dissociation of yin and yang implies death. Conclusion, the 8 principles are the guiding principle for syndrome, differentiation, and treatment. Okay, sa review, exterior syndrome indicates the exterior parts of the body is affected by exogenous pathogenic factor, and the disease is in its primary stage and relatively mild. Interior syndrome indicates the disease is in the interior parts of the body. Heat and cold syndromes reflect the states of yin and yang in the body. Deficiency syndrome chiefly denotes to insufficiency of health qi, while excess syndrome denotes to excess of pathogenic factors. Yin and yang is a pair of principles used to summarize the other 3 pairs of principles and are also the key principles in 8 principles. Thank you for your attention.
Thank you very much, Sir Dino. Up next is water element. We continue discussing the concept. The kidney yang activates the vital energy, and the kidney yin stores the vital essence or the jing for the entire body. A kidney yang deficient patient will have low energy to start the day, but this improves with activity as the day goes on. They also seem to be better on sunny days and when excited. Their best time for energy is around high noon, when general yang is at its highest point. In kidney insufficiency, the patient will be quite dynamic and energetic, but for short periods. Their energy state improves after rest, in the mornings or after a siesta or in the night. They can get quickly exhausted and need to rest in between. It is also possible that both yin and yang of the kidney are deficient, and the patient is tired all the time, except between 3 p.m. and 7 p.m., the maximum energy times of kidney and urinary bladder. It should not be assumed that tiredness or lack of energy is only a symptom of kidney deficiency. It could well be lung yin or yang deficiency. This may be in an asthma patient or a hay fever sufferer who does not get enough air. This is often worse at 3 to 5 p.m., the minimum energy time for the lung. The patient could also be liver blood deficient. This would also be a heart blood deficiency, as heart synthesizes the blood for the liver to store. The tiredness is often associated with standing, walking, or physical activity, and is worse around menstruation. Associated symptoms are lightheaded, dizziness, and blurred vision. Spleen qi deficiency. This is the tiredness that comes over the patient after meals, especially lunch and dinner. They could also suffer from edema and heaviness of the limbs. General points to treat low energy. This is particularly useful for a lot of patients. REN 6, C of energy, or Qi high. UB24, Bakshu point for the C of energy. Kidney 6 is called the wake-up point. Stomach 36, Earth point, nourishes the whole body and tonifies spleen Qi. And lung 9, which is a tonification point. The following points could be added to the points above when there is another deficiency. Okay, so for kidney yin deficiency, we add kidney 7, spleen 6, REN 3. Kidney yang deficiency, we add bladder 23, kidney 3, and bladder 67. Liver blood deficiency, we add bladder 17, spleen 10, REN 14, and bladder 15, the mu and shu points of the heart. Spleen qi deficiency, we add bladder 20, stomach 36, REN 12, moxa, and spleen 1. For lung deficiency, we add bladder 13, lung 1, and REN 17. Thank you very much for your attention. Let's now listen once again to Sir Dino for meridian theory. Hello, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with the extra points. EX, HN1, the Shi Shen Gong. The location, a group of 4 points, each located 1 tune from Do20 on the anterior, posterior, and lateral sides. So there are 4 points. These 4 points are generally used to increase the working power of Do20 as a tranquilizing point. All 4 are used together with Do20 and all points at an angle to Do20. EX, HN3, the yin tongue, which is located on the anterior midline, Dumai, between the eyebrows. Also, a good calming point. This is used mostly for problems of the nose. In this case, it is needled with pinched skin together the bridge of the nose along with points LI20 for treating common cold, hay fever, frontal sinusitis, nosebleeds, and blocked nose. EXHN5, Taiyang, which is located on the temple in a depression approximately 1 tune lateral to the midpoint of line connecting the lateral extremity of the eyebrow and the outer contours of the eye. This is a good adjacent point for the eye disease and pain, also used for aching as a local point. Anmian, which is on an imaginary line between points, triple warmer 17 and GB20. Amyan 1 is in anterior 1/4 and Amyan 2 is in the posterior 1/4. There are 2 points, Amyan 1 and 2. They are between triple warmer 17 and GB20 at 1/4 the distance from each other. Next, EXB1, the Ding Chuan, which is located 0.5 June lateral to the lower border of the spinous process of the 7th cervical vertebra. It is the calming asthma point used for cough and asthma. Thank you for your attention.
Thank you very much, Sir Dino. We now come to the last topic for this afternoon. We're still on chronic fatigue syndrome. We continue with the Chinese medicine concept of CFS. A weak constitution is an important predisposing factor for the formation of residual pathogenic factor. In particular, a constitutional deficiency of the lungs and spleen predisposes a person to the formation of a residual pathogenic factor. Being exposed to wind, cold, and damp weather too soon after or even during an invasion of wind may lead to the formation of a residual pathogenic factor. Excessive consumption of rich, greasy, sweet foods during and soon after invasion of wind may impair the descending of stomach qi and the ascending of spleen qi, therefore predispose the person to the formation of a residual pathogenic factor, especially dampness or phlegm. Chinese culture always places great stress on the need to take care during and immediately after invasion of wind. Taking care means not overworking, not being exposed to wind and cold, eating simple and nourishing food, and not engaging in excessive sexual activity. Antibiotics are one of the most common causes of the formation of a residual pathogenic factor in our society. Whilst they do kill bacteria, from the point of view of Chinese medicine, they tend to lock the pathogenic factor in the interior, as they do not release the exterior in the beginning stages of an exterior invasion, nor do they clear heat or resolve phlegm in the later stages. Dr. J.H.F. Shen uses an excellent metaphor to illustrate the effect of antibiotics. If we heard a burglar entering our house in the middle of the night, we could react in one of two different ways. Either we could get up, make a noise, and scare the burglar off, or if we had a gun, we could shoot the burglar dead. The first option is clearly preferable. The burglar leaves the house before having the opportunity of stealing anything. Our property and life are safe, and that is the end of the problem. Killing the burglar clearly gets rid of him, but at the cost of creating a bigger problem. The immediate difficulty of being lumbered with a dead body in the house, and the long-term difficulty of being in trouble with the law. If we take the burglar to symbolize the invasion of an external pathogenic factor, the first option corresponds to the way Chinese medicine works. It gets rid of the pathogenic factor without harming the body. The second option corresponds to the way antibiotics work. They kill the bacteria, but they do not get rid of the pathogenic factor. The body is therefore lumbered with a residual pathogenic factor, the dead burglar's body. Antibiotics also favor the formation of dampness or phlegm as a residual pathogenic factor because they weaken the stomach and therefore transformation of fluids. Furthermore, Chinese medicine gets rid of the pathogenic factor by raising the immune response and strengthening the body's resistance. Although antibiotics kill the harmful bacteria, they inevitably kill beneficial bacteria as well and leave the body weakened. The above is not intended to be a critique of antibiotics, but an objective analysis of their mode of action compared with Chinese medicine. There are many instances when antibiotics do need to be used when an infection is advanced, widespread, and potentially dangerous. However, in many cases, antibiotics are used unnecessarily and routinely for relatively minor infections, and often for viral infections for which they are ineffective. Chinese herbs can be taken in conjunction with antibiotic therapy if necessary, as the two work in different ways. Antibiotics will kill the bacteria, while Chinese herbs will either release the exterior and expel the pathogenic factor in the beginning stage, or clear heat and resolve phlegm in the later stages. Indeed, Chinese herbs can also help to counteract the side effects of antibiotics. These destroy beneficial bacteria, and from the Chinese point of view, they injure stomach yin. This can be observed in the partial peeling of the tongue coating that occurs after antibiotic therapy. The addition of some herbs to tonify the stomach yin, such as Taijishan, Radix pseudocelariae, can help to counteract the side effects of antibiotics and restore the intestinal flora. In the case of CFS, the residual pathogenic factor is nearly always dampness, with or without heat. In CFS, dampness is typically in 3 locations: in the head, causing poor memory and concentration; in the stomach and spleen, causing digestive problems; and in the muscles, causing muscle ache, fatigue, and heaviness. So here is an illustration of the location of dampness in chronic fatigue syndrome. So in the head, we have feeling of muzziness and heaviness of the head, poor memory, and concentration. In the digestive system, we have epigastric, abdominal fullness and distension, loose stools, and constipation. And feeling of heaviness in the muscles, feeling of heaviness of the muscles, muscle ache, muscle fatigue on exertion. Thank you very much for joining, and we hope that you could join us again next time. Thank you.